We are again standing on the left side of the body today, and we can see we have reflected the pectoralis major, minor, axilla has been exposed. Now it's the time to expose the anterior of the arm. So we have removed the skin. You can see laterally this is the cephalic vein, and here we can also see on the medial aspect the basilic vein. This is the basilic vein, and this is the antecubital vein or the medial cubital vein. So we have reflected them, and we have reflected the skin, the superficial fascia, we have cut through the deep fascia, and now what we can see from medial to lateral, we can see in the superficial fascia basically the medial cutaneous nerve of the arm. This is the medial cutaneous nerve of the forearm. Then what we see here is the formation of the median nerve. You can see the Y, the medial and lateral cords of the median nerve. Deep here we can see the ulnar nerve. You can see the ulnar nerve. Then deep down we will see the radial nerve, and here we can see the musculocutaneous nerve. The musculocutaneous nerve is piercing the coracobrachialis. This is the coracobrachialis, having a conjoint origin with the short head of the biceps. And here you can see, here is the long head of the biceps. This is the long head of biceps. This is the short head of biceps. So laterally lies the long head of biceps. Now these heads join, and finally we have the belly or the combined belly of the biceps brachii. The biceps brachii, this is the tendon of the biceps brachii for insertion. If we have cut it in the middle, we can see the musculocutaneous nerve piercing the coracobrachialis and supplying the muscle biceps brachii from below. It also supplies the medial 2/3 of the brachialis. So this big muscle here, this big muscle is the brachialis muscle, and this receives on the lateral 1/3 nerve supply from the radial nerve. If you see the arteries over here, this is the brachial artery. See, this is the lower border of the teres major. From below that, the axillary artery changes to brachial artery, and it is accompanied by vena comitatus. By the vena comitatus. This is accompanied by this as the basilic vein, and after it crosses above the lower border of the teres major, it becomes the axillary vein. It becomes the axillary vein. So we have the basilic vein, then we have the brachial artery, and see the most prominent branch of the brachial artery is the profunda brachii artery with its vein, and it is accompanied by the radial. So they pass into the spiral groove, and here we can also see another branch of the brachial artery. This is the superior ulnar collateral artery. This accompanying the ulnar nerve, piercing the medial intermuscular septum and going to the back of the arm. Now we will just go to the lateral aspect. We see this is the belly of the biceps brachii. This is the brachioradialis. This is the musculocutaneous nerve that is becoming lateral cutaneous nerve of forearm. Now if we go deep to the brachialis, this is the brachioradialis. This is the brachioradialis muscle, and on it, that is sandwiched between the brachialis and brachioradialis, this is the radial nerve that is piercing the lateral intermuscular septum and appearing in front of the arm in the lower part, just in front of the brachioradialis muscle. So this is the brachial artery with its profunda brachii branch, the superior ulnar collateral artery, and here below we have the inferior ulnar collateral artery. There are numerous muscular branches supplying the muscles. So we are standing on the left side of the body. So now if you see, this is the cubital region. So we have removed the skin, the superficial fascia. In the superficial fascia, on the lateral aspect we find the cephalic vein, and on the medial aspect we find the basilic vein, and in the roof there is the joining of or a communication between the cephalic and the basilic. This is the median cubital vein. Now as we cut through them, we can expose the region. The roof, we get the deep fascia. The deep fascia here is reinforced by an aponeurosis. This is the biceps brachii. This is the bicipital aponeurosis that blends with the deep fascia of the antebrachial fascia, deep fascia of the forearm. So I've cut that. Now that helps us to delineate the boundaries. So we have an imaginary line above going between the two epicondyles. Medially, the pronator teres muscle. So this is the pronator teres muscle. Laterally, we have, this is the brachioradialis muscle. You can see this is the brachioradialis muscle. So this triangle, the apex of the triangle is facing downwards where brachioradialis and the pronator teres meet. So this is the cubital fossa. The floor, if we can see, we remove the biceps tendon. So see, this is the brachialis. So this is the brachialis tendon. Upon neurosis we can see. So the upper medial part of the floor is formed by the brachialis muscle, and if we move the brachioradialis muscle, then we get one more muscle here. This is the extensor carpi radialis longus. Inner to that or medial to that, we find one deep muscle. This is the supinator. So the floor in the lower lateral part is formed by the supinator muscle. Now if we see the contents are from medial to lateral, we have MBBR. So M stands for the median nerve, B for the brachial artery. This is the another B for the biceps tendon. So this is the biceps tendon, and lateral most part is the radial nerve. Now this radial nerve is ideally not included in this triangle, but we cannot ignore this as well. So this is the radial nerve. So median nerve, brachial artery, biceps tendon, radial nerve, MBBR, from medial to lateral. Now if you see, the median nerve leaves the cubital fossa between the two heads of the pronator teres. This is the humeral head. Below we have the ulnar head. Between these two it leaves. Then we have the brachial artery. Just take a closer look at the brachial artery. So this is the brachial artery. Brachial artery is dividing into ulnar and radial artery. Then if you note that the ulnar artery is dividing here. This is the common interosseous artery. The common interosseous artery is dividing into anterior and posterior interosseous artery. The anterior and rest of the artery is continuing medially as the ulnar artery. If we take a look, it comes out and appears under cover of the flexor carpi ulnaris. Alright, this is the ulnar artery. Alright, so here we can very well see the anterior interosseous, the posterior interosseous, and the anterior interosseous is accompanied by the anterior interosseous nerve accompanies the anterior interosseous. So we got some of the branches. So here you can see this is the ulnar, and we can see the ulnar recurrent or anterior recurrent branch. From this side, if you see, this is the radial recurrent artery. So this is it. So this is the, once again, this is the ulnar artery. This is the common interosseous, this is the anterior interosseous, this is the posterior interosseous. Okay, we can see the division here. This is the common interosseous. The anterior interosseous is accompanied by the anterior interosseous nerve.